So almost a million excess deaths in Europe in 2021. In many countries, a large portion of the excess deaths in 2021 occurred in the end of the year from October to December. And then suddenly a very striking peak of deaths in the middle of the summer with virtually no COVID cases. Each time you can see, following the rise in the injection curve, it is followed by a rise in excess mortality. Hello, this is Veli-Martin Keitel, and I am here to wrap up the statistics, what the statistics are saying about excess mortality in 2020, 21, early 22, and how all that relates to the COVID pandemic and its treatment. We are mostly looking at Europe, but also the situation worldwide. The information is from mortality.org and ourworldindata.org and can be downloaded from those sites by anybody. And since I am in Finland, I will present some more detailed information from here. At first, we can notice that in most countries they've had more excess mortality in 21 than in 2020. In this chart we see 26 countries and 18 out of them had more deaths in 21 than 20. When we talk about excess mortality, in this case it means how much more people have died than the average from 2015 to 2019. Let's remember that during these 2 years we had the COVID-19 pandemic, and officially in 2020 there was no medication for it. Whereas in 21 we had the COVID injections, which in this case we can see rather as medication than vaccines, since they didn't produce immunity for the disease as traditional vaccines do. According to this data, the total number of excess deaths in all these 26 countries together was about 1.1 million in 2020 and 1.3 million in 21. In the 21 European countries, the corresponding figures were 460,000 in 2020 and 540,000 in 21, so substantially more. The summed up population in these 21 European countries in this study is about 440 million people. When we consider the total European population, which is 750 million, we can estimate the total number of excess deaths in Europe in 2020 to be almost 800,000 and in 2021 over 900,000, so almost a million excess deaths in Europe in 2021. The 8 countries in this chart that didn't have more mortality in 21 than 2020 were countries generally where they had exceptionally high mortality in the spring and autumn of 2020, such as the UK, United Kingdom, Italy and Sweden. In this list, Sweden was in fact the only country that had no excess mortality in 21. Another thing we can notice here is that vaccine coverage didn't seem to play any role on mortality. A vaccine coverage here is taken as the percentage of fully vaccinated people, so usually that means 2 doses, by the 1st of January 2022. For example, Portugal, which in this list had the highest coverage, also had one of the highest mortality rates in Europe. Lithuania and Greece did even worse in terms of deaths, yet they had about the same vaccine coverage as Sweden that, as we already stated, had no excess deaths in 21. we will see that in many countries a large portion of the excess deaths in 21 occurred in the end of the year from October to December and continuing in some cases to January 22. This is somewhat peculiar since that was the time of the Omicron wave, which according to the official data was a less lethal variant than the original and the Delta variant in the previous summer. A good, or perhaps rather a bad, example of this is my home country, Finland, that had the highest excess mortality among the Nordic countries in 21. This chart here displays the mortality fluctuation from 2015 to 2022. The thicker lines show the deaths over the 3 last years. Lighter green is 2020, red is 2021 and dark green is 22. As you can see, yes, there were clearly some excess deaths in April and May of 2020, but not as much as in March 2018, the blue line here. So this green line here is the 2020 excess deaths and this blue line is 2018. And that was when we had the severe influenza B epidemic, which was going around the world that year. In 2021, the mortality stays on average level up until May here. But then the curve suddenly starts rising and by July it's on record-breaking level. And this trend continues even up to April 22 and this is where the data ends. So the data at this moment of recording this video, there is no data beyond this point on the Finnish mortality. A clear international trend, at least in Northern and Western Europe, is also that COVID cases rise dramatically after the beginning of the booster campaign, which is also the case here in Finland. In Finland, the booster program started in mid-late September and the cases started clearly increasing in October. A sharper increase in booster administration started in November, followed by a very steep increase in cases. So this is also the time of most COVID deaths, as the orange curve shows. This is not to say that the injections are the cause of this rise in cases and deaths, but at least it seems this medication wasn't very effective when, after all, the Omicron wave was not supposed to be that dangerous. A quick look into India seems to verify this pattern. Not only do we see a sharp increase in cases and COVID deaths after the start of the booster campaign here, which started in December, but this is even more observable in the spring of 21. See how the cases, light blue here, and very soon the deaths, the orange line, rise in April and May after the initial injection campaign. Then in Japan, we can clearly see this same thing in this cumulative chart, how the cases and COVID deaths went on a sharp inclining path right after the beginning of the booster campaign. The same observation can be made in New Zealand. In both of these countries, COVID mortality was very low up to the end of 2021. And then as an example from Africa, Morocco displays a similar rise of cases and deaths in August 21. This is after the second injection doses, and again in January and February after the boosters. In East European countries, there was very little or no excess mortality in the spring of 2020, when many of the Western European countries suffered from the first COVID wave. On the other hand, they had very high mortality rates between March and May 21 after the initial COVID injections had been administered, such as was the case also in India. This can be seen very well in the chart from Romania. Just look at this dark purple colored mountain of excess mortality that peaks here in mid-April. There's another strange increase of COVID deaths and excess mortality in June and July, in the middle of the summer, the warmest time of the year, and the two bumps in the orange line of COVID deaths here suspiciously resemble the bumps in the injections curve some 5 weeks earlier. After the booster injections project started in August, there was this huge increase of mortality, and again after the first wave of the second boosters, that is the fourth doses here in February 22. In Estonia, a somewhat similar scenario took place. Very high mortality during March and April, and then suddenly a very striking peak of deaths in the middle of the summer, with virtually no COVID cases recorded, the light blue line down here. What then, if not COVID, was the cause of this huge outburst of deaths? And again, a substantial rise of excess mortality starting in August, September, following, if not caused by, the booster campaign. The most dramatic rise of deaths in the spring of 21 was observed in Bulgaria and Poland. In this chart we can see the deaths during the months of March, April and May between 2015 and 2021. As you can see, in both countries there was very little fluctuation from 2015 up to 2020, despite the so-called COVID spring of that year. And then suddenly in 21, a 50% increase in Bulgaria and a 40% increase in Poland. In Poland, this is especially troubling, with almost 40 million people. This chart shows that the excess deaths occurred also among the working age people from 15 to 64, both in the spring and late autumn of 21. Although we can notice a substantial peak in October and November of 2020, the green line here, the November-December peak in 21 was in the same scale. Remember that in 2020 it was a deadlier variant of COVID and no medication, at least according to the official information. The following chart shows the deaths from weeks 37 to 50 over the past 7 years, so the same weeks each year. This is the time of the most pronounced excess mortality in Poland. The rise is more striking in the age groups above 64, but also among people under 65, there was substantially more deaths in 2021 than before 2020, and only slightly less than in 2020. In Poland, during 2020, there were about 70,000 excess deaths, and in 21 there was about 115,000, over 50% more. This sums up to almost 200,000 extra deaths over those 2 years. Now, did the medication actually take down the fatality of COVID? In most countries it seems that the case fatality rate, the percentage of deaths among the diagnosed cases, stayed on the same level from about May 21 till the end of that year, only declining in 22. In 2022 the overall testing was taken down, and obviously then a smaller percentage of actual cases was recorded than before, thus affecting the case fatality rate as well. And even if the CFR, the case fatality rate, was dropping in January and February 22, in many countries the excess mortality not necessarily recorded as caused by COVID was still on the rise. Let's take a few countries as examples. First we'll take a look at Estonia. The light green line, the case fatality rate, stays around the same level as you see from about May till the end of the year, then dropping in January 22. Hospital admissions, shown here as 8-week averages, were increasing in late 21 and early 22. The blue line shows what percentage of those hospitalized because of COVID ended up dying eventually. This percentage also didn't remarkably go down, not even in 22. You might claim that it was the unvaccinated people who died in hospitals. But even if this was the case, why were the hospitalizations generally because of COVID increasing in 22, although most people were already fully vaccinated? And if the injections were supposed to take down the fatality of the disease, why was the CFR, the case fatality rate, not going down during the second half of 21 when most of the injections were administered? In Norway, excess mortality was also increasing in late 21, particularly in November and December. Case fatality rate during this time was actually increasing, and so was the amount of hospitalizations and the hospitalization fatality rate. What we can also observe in Norway is that the excess mortality curve, the dark purple curve here, goes quite a different path than the orange line of COVID deaths. So here in November, December, there were lots of people dying because of some other reasons, with some other cause of death than COVID. And this was indeed the same in Finland. In Germany, we can observe a surprising spike in the case fatality rate here in July 21, again in the middle of the summer, which is strange. There was also a peak in excess mortality here a bit earlier. Curiously, this was just after the most intense campaign of the first and second injections. Starting from September, the amount of hospitalizations was again in the rise, the red line here, as was the case in Estonia and Norway. Israel, a very interesting country as it was ahead of schedule with the injections compared to most other countries worldwide. The chart on the left shows in green the 3 major injection campaigns. First it is the initial 2 doses, then the 3rd doses or the first boosters, and finally the 4th doses or the second boosters. each time you can see, following the rise in the injection curve, the green line, you see it is followed by a rise in COVID cases. The light blue line somewhat obscured behind the other lines, and also the COVID deaths, the orange line, and excess mortality, the dark blue line. So bumps here in the vaccines and bumps here in the deaths, and before any injections were available in early December, late November here, the excess mortality was on zero level. There was no excess mortality. Whatever you think about the situation, it makes you wonder how would these curves have looked like without the injections. Would they, these peaks, have been even higher, or maybe not been as high as they were? What is the most alarming observation in Israel is that clearly the highest peak of deaths was observed in February 22 after the second booster campaign here. Obviously the idea of boosters was to reduce the deaths, not increase them. The CFR case fatality rate was going down in February despite of the increase in death. This was because there was such a huge surge of cases, which we can see here in late January and early February, curiously just after the spike of the booster injections. Apparently this development also shows up in the increase of hospitalizations here in February and March, and the hospitalization fatality rate was in February still on the same level as it had been as early as June 21. So at this point in 22, lots more people going to hospital than in the summer, but about the same percentage of those hospitalized people dying, meaning as an absolute figure, a lot more people dying, as we can see here. If we now suppose there was an actual outburst of the COVID epidemic in early 22 in Israel, and the injections just were not able to tackle it, then was there a similar outburst in the neighboring countries? Let's look at that. In Lebanon, there was some rise in COVID deaths, yes, here, the orange line. We don't have the excess mortality data from Lebanon, unfortunately, but the increase was more steady. It was smoother, it was not dramatic bumps in the mortality curve. And again, the peak here in early January comes after this very high spike in the injections curve, the boosters. In February, there was some new rise in the COVID deaths curve, but only about half as many per capita as in Israel, even though in Israel much more injections were given, so the situation is quite different. In Jordan, another neighbor of Israel, again there was increased deaths in February here, but again less than half as compared to Israel, and still again occurring after this intense booster campaign. Notice the steep increase of COVID cases here, the blue line almost duplicating the shape of the injections mounting about a month or a little more than a month before. In Northern Europe, the dramatic increase of COVID cases and deaths can hardly be observed more clearly in any other country than Denmark. Here you can see the percentage of fully vaccinated people, people who received boosters, COVID cases and COVID-related deaths in quarter-year chunks, so 3 months at a time. The last column on the right displays the first 3 months of 22 up to 20th of March. So some of the data from that quarter year is still missing. Yet we can already see a substantial rise of cases in the last quarter of 21. So this is, the date is 1st of January. It means that it is from that date 3 months behind the earlier 3 months. But in early 22, the number of cases just skyrocketed to a whole different range, at least like 4 times, more than 4 times higher than it was over the previous 3 months. At the same time, even if the case fatality rate goes down, the deaths also dramatically increase in Denmark. In Finland, although the excess mortality in 21 was higher than Denmark, which had the second highest mortality in Scandinavia, the excess deaths between November 21 and February 22, so this is showing those 4 months, November, December, January, February, didn't shoot up as much as it did in Denmark. However, it was still 10% higher than a year before and 16% higher than 2 years before. And this increase in deaths in midwinter, when we were moving from 2021 to 22, it was the time when some 80% of adults had received at least 2 COVID injections. If you look at the Finnish booster data in more detail, we can see that in each age group, COVID cases, which is always the thin line here, are rising after the booster campaign that was targeted for that same age group. So first we see this bump in the boosters, and it's followed by this rise in cases. However, although the boosters were given first to the oldest people and then in consecutive steps to the younger age groups, the cases always started increasing about the same time in weeks 50-51. Apparently, this is because of the high infectivity of COVID and the cumulative effect of different aged people infecting each other. In the next slide, we can see the curves of the 40 to 50-year-old people, and here, in addition to the tenfold magnified curve of cases, which is here, the light blue line, I've also displayed the cases line, the dark purple line here, in the same scale as the injections. What you see here is that the cases still started clearly increasing in week 50 and 51, still after the start of the booster campaign. This age group is like 40 to 50 is obviously more outgoing than the older people, so infections are likely to spread more rapidly and wider. It seems then that it was mostly the people under 60 years old who were spreading the infections, and then in all age groups they peaked pretty much the same time. The highest peak in week 12, as you can see here and on the previous slide. Each age group, the cases peaked in week 12 and started mostly increasing in week 50 to 51. Again, if this effect was not actually caused by the injections, weren't they supposed to reduce the cases and the deaths following the spread of the epidemic, which didn't seem to happen? And although the cases peaked in week 12, excess deaths peaked in the most vulnerable old people in the 75 plus group already here week 3, 4, 5, so very beginning of the year 22. And strangely, the deaths attributed to COVID, the orange line, only peaked in week 10. In this chart you can see the boosters in all age groups above 40 except 60 to 74, which would be between these two blue curves here. A vast majority of these infections in Finland were the mRNA type, messenger RNA, which makes your body produce the spike proteins. A COVID case, again, is diagnosed with a PCR test that detects fragments of the coronavirus, the SARS virus, which the spike protein now produced by the body actually contains. So the huge increase of cases after the booster injections, it's not then necessarily a sign of an actual COVID, a natural COVID infection, but a sign of the body containing the spike protein. And since in practically all countries the excess deaths increase in the aftermath of the booster campaign, doesn't it seem at least plausible that it is the spike protein produced as an effect of the infection that causes the increase of cases, which then spread widely into the population and eventually cause the deaths of the most fragile people? Now that we've looked into the deaths of the old people, let's finally focus more on the excess deaths of people who were under 65 years of age, as we already did with Poland. And let's start again from Estonia. This messy looking chart again shows the fluctuation, weekly fluctuation of deaths among all age groups in Estonia from 2015 to April, and this data is available at mortality.org. And we focus again on the three thicker lines, the green for 2020, the lighter green, red for 21 and dark green for 22. What we can see in Estonia is that there was all throughout the year substantially more deaths in 21 than 2020, so the red line here is all the time clearly above the green light of 2020. This was the case in all age groups in Estonia, even among the children. So this was in 15 to 64 years of age. But when we look at all ages, we can see that the difference between 21, the red line, and 20, the green line, is much more dramatic, which means still that there was much more emphasis on excess deaths in the group of people that were older than 64, from 65 upwards. However, it is very alarming that in the age group of under 65, it was still on a very high level compared to the previous years. In Finland, the corresponding tables are quite clearly different. We look at the time period with the most excess deaths, which in Finland was clearly later than Estonia. So I'm taking here from week 45-21 to week 6-22. Yet even in Finland there's a slight rise in the 15 to 64 age group, and sadly also among the children under 15 years of age. So at least the first vaccine doses administered to children in January 22 didn't bring down the deaths of children as it was rising to the level where it had been last time in 2017, late 2017, early 2018. So remember, each year this is the same weeks. In Hungary, we see the same pattern as we saw in other East European countries. High peaks of mortality in March and April, and again in November and December in 21. And now observe, this is the 85 plus age group, where in 2020 the green line, there were more deaths than in 21. However, when we look at the 15 to 64 years old, the red line in 21 is far more pronounced, both in the spring, especially in the spring, but also in the autumn than in 20. Notice how the lines of pre-2020 are grouped together as this kind of a bunch, then a substantial rise in November, December 2020, but much more excess in spring and autumn 21. So what is the cause of that when there was the epidemic but there was supposed to be an effective cure for it? Let's look at another country with a similar situation in this respect, which surprisingly is Germany. We see that in late 2020 there were more old people, again 85 plus, dying than late 21. The death numbers are still in record levels. Here up to April and May, in the elderly people is very high death numbers, which was not the case in Hungary. Looking at the age group of 15 to 64 in Germany, we noticed that in November and December 21, during the COVID booster campaign, there was far more deaths than there were in 2020. So it's curious that before the injections, most of the people who died were the oldest people, the 85 plus, who were already kind of beyond their life expectancy. But then in 21, the kind of the high point of the injections, when most people were injected and there was this booster campaign, then it was the under 65 years old people who had a pronounced rise in mortality. In early spring 22, the mortality in this group in Germany did return to the average level. However, from August to December 21, some 16,000 more people in this time died than during the same months in 2015 to 2019 average. To make a difference with Hungary though, it's good to notice that the peak mortality in this age group in November was around 37 people per million per week, whereas in Hungary it was more like 90 people per million per week. So in Hungary it was a lot more. This is to further emphasize the fact that generally the excess deaths in Eastern European countries were much more numerous than in Central Europe. Another matter of great concern in Germany is that from May to December, as we can see here, children's deaths were on an exceptionally high level, highest since, and on par with the level they were in 2016, which was an exceptional year. Okay, if you think Hungary and Germany looked bad, the situation is far, far worse in the United States. USA is a vast country with over 300 million people, so you expect to have more coherent lines from one year to another, and indeed this is the case from 2015 to 2019. But when we look at what happens in 2020 and 21, and particularly between August and November here, in the overall deaths, but especially here in the group of 15 to 64 years old, it is absolutely catastrophic. Indeed, in this age group in 21 as a whole year, there were 40% more deaths than the average of the years 2015 to 2019. This is even more catastrophic in the light of the coherence of the lines from previous years, where the fluctuation stayed mostly within 3–4%, so 40% more. And in September, this highest peak, there was almost 70% increase in deaths than the previous year's average. So for some reason, United States has been hit the worst, and especially in 2021 autumn. So next we'll just check if we can find this increase in this particular age group in other European countries to verify this is indeed a pattern. In Austria, this is very clearly happening, although there are still more deaths in the older age groups. It is only among the 15 to 64 years old where we see an increase, while the numbers in the other groups are going down or have settled. In Denmark, this development is perhaps even more observable, as the blue line here, the 15 to 64 years old, has been declining all the time since 2015, but in 21 has suddenly taken a rising trend. We can also notice a clear increase in children's deaths, rising higher than any other year in the 7-year data. And again, in Denmark also in January they started injecting the children with the first doses. In Netherlands, the 15 to 64 age group is the only one displaying an increasing line since 2019. Remember that in all these charts we are looking at the period of highest mortality in late 21, early 22. In this case it's from week 40, 21 to week 1, 22. New Zealand, which was doing so well all the way up to October 2020, went on a deadly roller coaster in January and reached quite alarming mortality levels by March 22. Also in the 15 to 64 aged group, a new record level was reached in March and again in early May, late April. Finally, it's good to look at least a couple of countries where things have not gone so bad. Italy, although witnessing lots of extra deaths in the turn of 2020 and 21, which we can see here and here, when moving from 21 to 22, saw the numbers returning to the level where they had been 2 years earlier. In Sweden, the same happened, as we can see in this chart. Despite the exceptionally high death counts in the spring and autumn of 2020, Sweden, after all the speculation, turns out to be a winner in this sad competition. As we see in this chart with the overall weekly death curves, there was nothing out of the ordinary going on in Sweden in 21, unlike all the other countries in our study. When we look more closely though, we can observe that as the death numbers were on a very low level from February to July, here the red line, in September the curve starts rising and goes on the top of the previous year's curves, and in late January it reaches, here the dark green line reaches a higher level than over the previous years. So the international trend of rising mortality during the COVID booster injections campaign here in the end of 21 and early 22 applies even in Sweden. Now sure, there was lots of 75 plus people dying in 2020, which is a tragedy and points to a failure in the approach taken in the care homes and maybe in hospitals. But the silver lining of this cloud is that when we start looking at the people under 75 years old, we notice that 2020 was not that exceptional. Even the extra bump in April 20 is more or less made up with the exceptionally low mortality in 22 and also in 2019. So all this 2019, 20, 21, 22 all combined probably sums up to somewhat a regular level of mortality in the amongst people under 75 years of age. In the 15 to 64 department, we see a very nice fluctuation that fits within. Actually, it stays pretty low compared to many of the previous years. In 22, this dark green line sinks to a very low level indeed. It looks like the combined mortality among people under 65 years of age in Sweden, again, unlike in most other countries, will turn out exceptionally low. At some point, there will certainly be a proper study into Sweden's COVID policy to find out why they did so well in 2021 compared to most other countries worldwide. We know some things that they've done differently in Sweden compared to other countries. For example, they never had a totally strict lockdown, they never had mask mandates, they never had strict restrictions for people meeting each other, for visiting patients in hospitals. So at least what they accomplished with this was less fear and stress than in most other countries, maintaining also a higher level of confidence and feeling of like being on top of things among the population at large. And when people are less worried, when they are more secure, they have less stress, they are less likely to get sick and thus less likely to end up dying prematurely. And actually in February 22, a commission set up by the Swedish government came to the conclusion that, and I quote, Sweden's broad policy was fundamentally correct. Fundamentally correct. There was some flaws in 2020, but still as a whole the situation was better than almost any other country. I hope the results of the studies from Sweden and elsewhere with similar results will be utilized to adapt a healthier approach in the case of future pandemics. And this is a time now to end this rather extensive look into the excess mortality statistics of 2021-22. Thanks for watching and see you again another time. Bye.